Hello, everyone. I'm Jackie Stevens, the Executive Director of Avalon Sexual Assault Center. During the COVID-19 pandemic, Avalon Center is closed and providing services as best we can remotely. I'm with Chantel Murphy, who coordinates the Avalon Sexual Assault Nurse Examiner program. Hi, Chantel.
Hi, Jackie.
The Avalon SANE program is one of the programs that Avalon provides that is continuing as usual. Chantel, how has it been so far responding during COVID-19?
Well, it's been in some ways unchanged in terms of we're still seeing the same clients we would normally see. We're still responding up to 7 days. So those pieces aren't changed. What has been impacted is our locations in the hospital. Sometimes we're relocated to other service areas, but by and large, we're continuing to provide service as usual.
And that's a really important thing for people to know, that the SANE program is still responding 24/7, up to 7 days after an immediate sexual assault, and can be contacted at any time, either by people accessing the hospital or calling our response line. How are the nurses doing right now, Chantel?
Well, the nurses are just like everybody else. They're feeling the stress of this situation, the impacts on self-isolation, but at the same time, all the SANE nurses have primary work outside of the SANE program, so they're continuing to go to their day-to-day jobs, and then they're also continuing with SANE. So it's impacting and it's causing some stress for sure, but they are a strong group of nurses, and their primary concerns are, how are we going to continue to deliver this service in the best way possible? How are the clients going to continue to access? It's those questions around, are the clients going to continue to come, more so than other concerns. So that's the primary kind of focus of the team right now. And yeah, so overall, feeling the stress for sure, but doing okay.
It's really important, as you say, is that, the nurses are on the front lines of this, and like all the other healthcare providers in our community, are working really diligently in this crisis to continue to provide the ongoing, very important services that they offer, and to provide, amazing medical care for people who do need to access healthcare at this time. Avalon Center, is really strongly supporting our nurses' capacity to continue to provide the SANE program, and working very closely, with the health authority, with the hospitals, to ensure that people who do need to access SANE services can continue to do so safely. And we really appreciate the work that the SANE program is offering on behalf of Avalon Center to people who've experienced sexualized violence in our community. What would you like the community to know at this time, Chantel?
I think my number one message is that we're still here. We're still providing service, that we don't anticipate that will change. So please, if you've been sexually assaulted recently in the last 7 days, please reach out. You can speak to SANE nurse 24/7, 365 by calling our on-call number. But you can also just show up at the hospital and we'll be there. We'll be there to see you within an hour. That's our response time. So that's really what I want people to be aware of, that as much as this situation is impacting our community, we're doing our utmost to continue to be there for the survivors of sexual assault.
Yes, that's a very important message, Chantel. Thank you. And I just want to reiterate that as well, is, in this time where, again, when we will be open at the office to provide services the way we were doing so prior to COVID-19 is uncertain at this time, but it is important that people know that we are continuing to provide programs and services at this time, and will continue to do so to the best of our ability. And we still continue to support and believe and be there for victims and survivors of sexualized violence. Thanks a lot, Chantel.
Thank you, Jackie.
Take care, everyone.
Bye.